I'm Dr. David Hill, and today we're going to be talking about how to get rid of earwax. Now, in my pediatric practice, this is a question I get a lot of. Parents see wax in the child's outer ear, get worried about it, think it shouldn't be there, maybe it's unsightly, and they want it out of there. However, the important thing to remember is that earwax, we call it cerumen in medicine, serves a very important protective function for the ear. Earwax is kind of magical stuff. Obviously, it forms a physical barrier between dirt or insects or things that might try to get into the ear, but it also forms a chemical barrier. Earwax is slightly acidic and it suppresses the growth of bacteria. So ideally, the ear is going to keep some earwax in it at all times. Too little earwax is one of the causes of an external ear infection or swimmer's ear. Now, how does the ear clean itself? I've got a model of the ear. Earwax is formed in the outer portion of the ear canal. It really doesn't form down by the eardrum. The only time we see earwax down by the eardrum is when somebody's used a Q-tip to try and get it out. And let me show you what happens. You'll hear doctors tell you always never to put a Q-tip in the ear. Why? Well, the ear canal narrows about halfway down. And when you put a Q-tip in to try and get the wax out, what you really do is you just push more in until you get to this bottleneck right here, and that's usually where it stops. So Q-tip, bad. Some people say, well, I just clean the outside of the ear. Great. But if you're going to do that, just use a washcloth in the bath. So how come our ears aren't totally full of wax all the time? Well, this is a neat thing about ears. The skin of the ear canal actually grows slowly outward. It's like a little conveyor belt that's carrying the wax always toward the outside part of the ear, where it dries up and falls out or comes out in the bath from time to time. Now, there are some things you can do if you or your child are prone to clogged ears. There's some home remedies. You can instill, for example, a solution of half alcohol and half white vinegar, which is just acetic acid, especially if you're a swimmer or your child's been swimming a lot. That may be protective against swimmer's ear. To put a few drops of that in the ear and then shake it back out after every contact with water. You can also buy over-the-counter medications. One brand name is Debrox, and you can also use plain mineral oil or baby oil. You don't want to use vegetable oil because that can go rancid, but you can use a mineral oil to sort of loosen up the earwax and help it come out. Another simple thing is just washing the ear with warm water and soap during bathing to get the wax out of the outside of the ear. Now, when wax is really a problem, if it's causing pain or inflammation or hearing loss, the doctor is going to want to look in that ear and assess the degree of the problem using an otoscope. We have special instruments like these ear curettes, and we can always, watching what we do through the otoscope or in an ear, nose, and throat doctor's office through an operating microscope, we can see exactly where we're going and make sure that we're not pushing the wax farther into the ear, and also make sure that we don't injure this very delicate skin inside the ear canal as we're pulling it out. Even then, it can be a painful procedure and can cause some bleeding, so it's something we try to avoid. We'll often use some form of wash instead to get the wax out, although if you're going to wash the ear, a doctor has to have looked in there first to make sure that the eardrum doesn't have a hole in it, because you don't want to wash debris and bacteria down into this very sensitive middle ear. So, talking about how to get wax out of an ear, I'm Dr. David Hill.